for some and doing my Botox for my little frown lines that I've had since I was like 21. My mother had them, and so they're basically, I mean, they're hereditary, right? Like certain people are predisposed toward having wrinkles in certain places, or am I making that up?
No, we all have little muscles up there, and so we all tend with time to get changes. People with thinner skin or with heavier brows and heavier muscles in the area can tend to get these things happening sooner.
Okay. And for me, because I frown when I sleep, so I wake up, and recently it's been like maybe 6 months since I've had my Botox, and so I wake up and I have these like furrows.
Get you dreaming about something else. All right, I'm gonna lift you up and sit you back for a second, Nadine. A little squeezy ball.
Yes, please. So I don't like
One
needles.
brown, one blue.
Hi.
Okay, so just sneak up a little bit towards me. And tip your head right back. That's it. So we're going to take care of these little muscles here. Give me a squeeze. So we see these are the muscles that pull the brow inwards and give you the sense of crease there, the number 11s that people like to call it. Just relax now. Okay. So we're going to inject right into the muscle.
What muscle is that?
That's the corrugator supercilii. That's the muscle that pulls the brow inwards. A little pinch for a sec, Nadine. How are you finding it?
I literally barely feel it, because what did you put on me earlier?
I put a little numbing cream in to begin with. And this, we find, is really generally very tolerable.
I like literally barely feel it, and I have a pretty low pain tolerance. I feel like I'm shilling for Botox. Like, it's so easy. Everyone should have it.
It's working. Keep it up. So we're just doing a little bit of massage to make sure the Botox gets taken up by the muscles we're interested in. And I don't want you to do this at home. Just for the next half hour or so, while you're sitting outside, do a little squeezing.
Okay.
Make everyone who walks by you think you're nuts. Do the same thing on the other side.
Okay.
So Dr. Linder, can you explain how Botox works? Because some people get confused between that and what fillers do.
Yeah. So Botox is a protein that gets taken up by the muscle and actually blocks the muscle at the nerve ending. So it keeps the muscle from contracting, and so the muscle as a whole relaxes a little bit. It takes about a week or so to really see the full effect, and some people a little bit longer. It lasts for about 3 months. In general, what we find is that people who routinely use it and come back every 3 or 4 months can find that the behavior that causes the deep lines, that causes the frowning, will stop. So Nadine's going to stop frowning all night in her dreams. And over time, these lines start to settle down a little bit. Okay, so a little pinch again here for a sec. So we're aiming right for the center of the muscle.
So we find a little bit of numbing medicine does help beforehand, and just taking out that little sting. Some doctors use ice, others don't. It just depends. And some patients will ask for nothing at all. So it really depends after your own experience, what sort of pain tolerance you have.
I recommend numbing cream.
We're still friends though, right?
No, I mean, I barely felt it. I really am a big baby when it comes to pain and needles.
You're doing great. You haven't flinched a little bit. So everyone out there in blog world can tell that you're pretty brave. Okay, give a little squeeze again now. So now we're going to do a little top up in the procerus, which is the muscle that runs here up and down and helps to vertically contract the brow. So we'll relax that because that's what forms some of the little horizontal bunny lines that people get in the area just below the forehead. So I'm going to pinch here again for a sec. Ouch.
Yeah, that's the line I feel like I see it when I laugh really loudly. And I look in a mirror, it looks like there's like the two muscles are kind of coming together in my forehead.
So you're saying, Dr. Linder, how is Botox different than filler? You explained the Botox, but I don't think you really elaborated on the fillers.
So that's how Botox works. It works on the dynamic wrinkles, the wrinkles that are made worse by movement. So very commonly we use it around the forehead, in between the eyes, the 11s here, and the crow's feet right around the eyes here. What it can also do is give a very nice little lift to the eyebrow, which we're going to do in a moment. Filler is a totally different product. There are a number of different types of fillers, but they all work essentially by increasing the volume in the tissues. So we tend to use that more in the cheek area, under the eye, around the lips, and in the lips themselves to give some more volume and augmentation for people who always want a little bit bigger lips, or for others who are noticing the early signs of aging, starting to notice some volume loss and flattening around the cheeks, some deeper lines and creases around the mouth, in the folds, and the filler can do really well right there. How are you doing?
Good, yeah.
Ready for the last little bit?
Yeah, I'm ready.
Okay.
So I find that my friends that haven't had Botox, whenever I tell them that I'm having it, they think that I'm going to look like Desperate Housewives, that sort of like really frozen look.
Yeah.
I've tried to explain to them that it takes a lot to get that look. Like you have to actively pump it.
It doesn't have to be that way.
Huh.
Let me tell everybody, Botox is a tool, and you can use it either as a hammer or as a feather. And if you really go crazy and snow someone's forehead, well, yeah, they're going to have that porcelain, smooth, can't move my brows, deer caught in the headlight kind of look. What we're really aiming at doing is just like what we do with surgery. A little poke here for a sec. Is to soften. We're not trying to get rid of every little line crease, every character mark on the face. We're just trying to reduce the signs of aging, and just give a softer, brighter, fresher look.
You but better.
You but better.
Yeah, that side didn't
Not
feel
that you need a whole lot of help,
awesome.
maybe. So we neglected to put the numbing cream over these brows here, so.
I felt that a little bit more, but it didn't. I mean, it didn't.
A little bit of this thing.
It's a
It's
piece.
tolerable. Yeah.
I'll just hold pressure here for a sec to stop any little tiny pinpoint bruise that you get. Really nice thing about Botox is you can do it very quickly, right over lunch. You can get back right to activities. Doesn't cause any significant swelling. Should not cause any significant bruising at all.
And you can put on your
You
Bare
can put your
Essentials
makeup
mineral
on.
makeup afterward.
They missed the thumbs up. You want to do that? I was zoomed in a little bit. They missed that.
This one's a little more sensitive.
Yeah.
Hold on. Did great.
Yay. All right.
Ready
Any
for
last?
my lollipop now.
Any last statements? All right, guys.
Thanks for joining.